Hello everyone, my name is Anele Siswana, a clinical psychologist. So today we are talking about anxiety. There are different types of anxiety disorders, but today we'll focus on just one element or a generalized understanding of what we mean when we speak of anxiety, or what is commonly known as generalized anxiety disorders. In definition, my simplest way of defining what anxiety is, it is an excessive worrying about worrying. Sometimes the worrying is contextual. It could be in terms of social spaces. It could be triggered by a certain animal or a certain thing that makes you uncomfortable or kind of heightened. But this kind of anxiety that I'm talking about is the anxiety that most people experience. That is, now we're on times of COVID-19, which leaves people with a certain number of symptoms that could be physical symptoms, that could be psychological, that could be cognitive. And what do I mean by that? Cognitive, some people, when they have this excessive worry and constant fear and this kind of energetic thing that makes them really, really worried, it really causes what we call a significant level of impairment. We all have degrees of being worried, but when it comes into excessive anxiety or a generalized anxiety disorder, it's a matter of where one cannot function normally like they usually do. What you would find at work, they may have kind of difficulties at home, they would have difficulties or in their kind of social relations. But in the context of where we are now, you'll realize that most people's worry or most people's stress and frustrations have to do with uncertainty. We all want a degree and level of certainty in our lives, and so one of the symptoms or the ways in which you would see that this is really affecting one, it will be this constant excessive worrying that makes one not function normally. At the same time, what you realize is that with all that is going on with uncertainty, there would cause also a factor where people struggle with kind of slight depressive symptoms. But with this kind of worrying, it's worry that is so uncomfortable that you don't know what you will eat tomorrow. You don't know at the end of the month how you will pay your bills and everything that needs to be paid. That is what would constantly exacerbate this inappropriate sense of worry, sense of being overwhelmed, and all of that which I have explained. But what is important, it is to realize that there are self-help activities and things that you can do when you feel this sense of worry or excessive worrying about worrying. If you are, for instance, struggling with worrying and frustration that has to do with money, you need to ask yourself, do I really need to worry about this? If I do have control over money, yes, I will. If I don't, what are the kind of options that I can explore? And we must understand that if, for instance, if your major thing has to do with financial worry or financial stress, you need to find other alternative ways. If you can get a loan, if you can get any form of support that can assist you to manage that level of anxiety. Other people try what we call relaxation techniques. Relaxation techniques are things that you can do to relax. You breathe in and out, and walking outside, or doing something that will lessen the level of worry about what is mostly your trigger. And most importantly, when this inappropriate fear and worry extends, then that it's find it difficult for you to cope with it, I would then suggest that you start seeing a health professional, someone who's much more trained, that will be able to understand the degree of your symptoms. And you must know that for it to be an anxiety disorder, there's a particular phase, a particular number of days, a particular number of weeks that a clinical psychologist or a psychiatrist will be able to locate that in a more clinical setting. So what I'm trying to say is that there are self-help activities. There are professionals, a clinical psychologist, other psychologists can do that as well, and as well as a psychiatrist, and mostly to use your psychosocial support around you, and to make sure that one of the ways of managing our health-related anxiety or worry, it is mostly sticking to social distancing, making sure that we stick to with sanitization, hygiene, all of those other things that are out there, wearing masks and wearing gloves and making sure that you're health conscious. That's another way of managing your anxiety about getting ill or about being infected with coronavirus and all. So there are various ways in which you can be able to screen, in summary. That is, look at your symptoms. Are they cognitive? Are they emotional? Or are they physical? At the same time as looking at the longevity and how long they've presented. At the same time, knowing that there is intervention from a psychologist, psychosocial support systems, as well as a psychiatrist. Where it becomes so intense, it is when now you need what we call psychopharmacological intervention, where a psychiatrist can help you with medication on how to manage that. So a systemic approach on how to cope with anxiety is out there. But if you need further information, you can catch us. We'll give you details of where you can get hold of us. At the same time, keep on looking out for every material that can assist you on ways of managing this. Until I see you next time on our topic on different types of anxieties. Thank you.